right. Good afternoon or good morning, everyone. My name is Bethany Hamilton. I'm director of the National Center for Medical Legal Partnership. I want to welcome everyone today to our Health Center MLP Planning, Implementation, and Practice webinar series. If you're joining us today, it is June 13th, 2024, as we're hosting this live event, and you're joining us on session 9 of our MLP PIP webinar series, where we'll focus on, as you can see on the screen, ditch the elevator pitch. This is where we will be joined by a very special guest to help us learn more about how to build effective messaging for different MLP or medical legal partnership audiences. So welcome back, everyone, or welcome if you're joining us for the first time. Let's go through some housekeeping slides next. As is typically the case, you're joining us via webinar on mute, but this particular webinar series is designed to be very interactive, so it's smaller, so that we can encourage and allow for a lot of engagement. So feel free to use the Q&A pane. The chat will also be open. Ping us if for some reason we did not just inadvertently make the chat live. Just let us know. But feel free to use the chat for engagement and let us know if you need assistance by sending a chat to us as host and panelists for today. Also, if you want to display the captions as we speak, select live transcript in Zoom. It's under the more options, and then show subtitles. Also, to answer your question in advance, this webinar will be recorded. It is actually being recorded right now, and it will be shared on the medicallegalpartnership.org website under the resources page. Let's go to the next slide. As I mentioned, we are encouraging a lot of engagement on this webinar series. So we want to hear from you, and we're dropping hints as to exactly when and how. So you may see one of the two following icons on certain slides where we're asking you to either use the unmute feature in Zoom or the raise hand feature, in Zoom, to raise your hand and let us know that you want to be unmuted to speak and share or pose a question. And then also same thing, you may see an icon to encourage you to chat. So you use the Zoom chat box to engage at certain points and use it at any time to ask questions or comment or engage with each other. Next slide, please. So if you've been joining us throughout the series, you may have seen this alphabet soup before. If this is the first time, just want to cover this very quickly for folks who might be new to MLP or to this webinar series. MLP, you'll hear that over and over and over throughout today's session. We are simply abbreviating medical legal partnership. If you hear us say FQHC or CHC, we're talking about the health center program that has been administered by HRSA. And so that might be a specific designation as we're referring to, federally qualified health centers for the community health center movement. And then HRSA is the abbreviation for the Health Resources and Services Administration, the federal agency that provides those Section 330 Public Health Services Act grants to health centers. And then also administers the FQHC or Health Center Lookalike program. And then as we are talking about medical legal partnerships, it's important to know that there's also a federal agency that provides the grants to the legal aid organizations that provide the most legal assistance around the country for those in need. And that federal agency abbreviated as LSC, or the Legal Services Corporation. So this is the alphabet soup, and we wanted to make sure everyone is level set in terms of what you may hear throughout the webinar today in terms of terminology or abbreviated versions thereof. Let's go to the next slide. Just want to thank and acknowledge that this is funded by HRSA, the Health Resources and Services Administration, and the National Center is in its 10th year of funding through a cooperative agreement that allows us to provide these trainings and resources to the medical legal partnership field. However, just note that the contents are those of our authors, our presenters, ourselves here at the National Center, and don't necessarily represent the views of HRSA, HHS, or the federal government. If you want to learn more about HRSA, visit their website at hrsa.gov. They are also an excellent resource that we will refer to at the end for answering technical questions. Let's go to the next slide, please. All right, so on this slide, just a reminder, this is a webinar series that we are co-hosting in partnership with the Texas A&M University Institute for Healthcare Access, led by Keegan Warren Clem. And we're also partnering with another faculty member. I'll mention that on a slide, another slide in just a moment. We are almost at the end of this webinar series. So just taking a moment to remind people that we kicked off this series in February of 2024, and it wraps up at the end of this month with a town hall event where we'll really focus on just engagement and talking about what we learned, what were the successes and challenges. So more information will be available at the end of the webinar and in the website that we built for this webinar series. We're following along with the Health Center MLP Toolkit. It's an excellent resource that still provides guidance, we believe, that's transferable or applicable across different MLP settings. So we'd encourage you to use the link to download that MLP toolkit and apply it to your work. And again, just a reminder, this is an active learning series, so look out for those icons to be able to engage. Next slide, please, Reha. Thank you. So speaking of engagement, let's go ahead and launch a poll for today. We always want to know who's joining us in the audience. And so let us know if you are from healthcare, legal services, academia, or perhaps another category. Then tell us, of course, do you have an MLP? It's okay if you don't know, let us know. We'd just like to know who's in the audience today. And then as it pertains to today's specific topic related to developing messaging for MLP audiences, tell us a little bit more about your messaging that you're developing or have developed for your medical legal partnership. That question should be set up so that you can answer in a way that allows you to check more than one box. So let us know, excuse me, if you're developing narratives for grant reports and applications, patient or client impact stories. Maybe you're developing a sort of information about your program that you can use to educate policymakers. Perhaps you're developing materials to help healthcare providers better understand legal needs and legal services. Are you doing all of the above? Or maybe you're here to really learn some foundational information, and the answer is none of the above, which is okay. This is a training event. Perfect. So we're almost at full participation. Let's get to 80%, and we'll close out in about 5 seconds here. Don't forget, let us know who you are, healthcare, legal services, academia, or other. Do you have an MLP, and then what sorts of messaging are you developing? All right, Rahel, let's go ahead and close out the survey and share the results. So it's great to see that we have another mix of folks from healthcare, legal services, and academia, and there's someone here from another type of organization. So let us know in the chat where you're from. Folks are welcome across all categories to let us know who you are and where you're from. Also, most of you have MLPs, but we are in fact joined by some folks who do not or are not sure. So looking forward to supporting all of you across that spectrum. And then finally, a similar variation or variety of responses that come in terms of types of messaging that folks are producing or developing for their medical legal partnerships. Really want to support the folks there who answered that they are not currently developing messaging for their MLP. So allow us to support you. This is a safe environment where you can candidly share what your needs are. All right, so we're going to stop sharing the poll and continue. Next slide, please, Rahel. All right, and welcome to the folks who are letting us know where they're from. It's great to have you here. So we are currently on session 9 of our MLP PIP webinar series. And if you're following along with the toolkit, we have pretty much done our best to associate the actual training topics with each of the topics in the toolkit. So today's session should correspond, generally speaking, with how we can make sure the MLP is effective and sustainable, but we're focusing on developing messaging to make sure that that can happen. And then, as you can see, as we continue to travel through the webinar series, some of the topics will be addressed or will have already been addressed. So continue to follow along. Let's go to the next slide. On today's webinar, we're hoping that everyone will come away with a better understanding of what inspires people to take action. We hope you'll be able to better identify how to build strategic messages for any audience. And then finally, we hope that you will develop MLP messaging that really focuses on those outcomes rather than process, and with a special focus on healthcare and funders, since we know that that is a topic in high demand. The faculty, let's go to the next slide. As you can see, have been Keegan Warren, our partner from Texas A&M University's Institute for Healthcare Access, and Jay Thicklick, adjunct professor of law at UConn, and also a part of the history of the medical legal partnership movement, having run an MLP in Connecticut that focused on pediatrics. Again, I'm Bethany Hamilton, director of the National Center for Medical Legal Partnership, and I'm your moderator for today. We are very happy to be joined again this week by a very special guest. Let's go to the next slide. So you'll see on the screen that Kate Marple is joining us again, principal consultant of Who Tells the Story. If you know Kate Marple, she's also our former communications director for the National Center for Medical Legal Partnership, and has really been doing this work for a couple of decades now in medical legal partnerships. So trust what she says in terms of successful and effective MLP messaging, but also, right, ask questions. Feel free to help us push so we can learn more today and really advance the field. We really appreciate the camaraderie and feedback that the medical legal partnership field continues to provide. Let's go to the next slides here. So we're also joined, you may have heard me mention her name already, Rehat Manikanasamy is our team's data scientist. She is running the behind the scenes, and so let her know if you need any assistance live as well as between sessions by sending an email to ncmlp@gwu.edu. She's happy to provide any resources. We have a whole lot of resources available for today's webinar, and then if you need help accessing the past or webinars or resources, we'll be happy to share that as well. All right, Reha, let's let people know about session 8, what we covered in session 8. Let's go to the next slide. Just a quick recap, reminding folks that the last time we were together, we were also joined by Kate Marple, who talked about this really important aspect of medical legal partnership practice, and that's trainings. So what we covered were how to craft effective trainings to really strengthen the health center MLP workforce, or really any healthcare MLP workforce. And we touched on the following learning objectives: identifying common MLP training needs and goals, demonstrating the principles of adult learning and their relevance to MLP trainings, and then really applying training best practices to the MLP context, what we do here in this collaborative work. Today on session 9, let's go to the next slide and I'll pass the mic on to Kate Marple. You'll hear specifically from Kate Marple on how to really ditch the elevator pitch to by developing those effective messaging for different MLP audiences. So with that, I'm going to pass the microphone as well as the video over to Kate Marple to begin today's substantive presentation. And folks, again, I encourage you to use the Q&A, the chat, and let us know what your questions are, and don't forget to engage. Thank you.
Thanks so much, Bethany, and thank you all so much for being here today. I'm super excited to be here with you. I am a storyteller. I'm a strategic communications practitioner, and I do a lot of training development. And for the last 4 years of my consulting life, I've been doing that with a wide breadth of organizations. But as Bethany mentioned, I spent over a decade with the National Center for Medical Legal Partnership, and always love any chance to continue to work with my first love, with the medical legal partnership community. So I'm excited to be here today. During this webinar today, I want to kind of break it up into 2 sections, which is that in the first half, I really want to talk about messaging broadly. So tools that will be really useful to MLP, but aren't necessarily MLP specific. Things about like how people engage with information, why people take action, and what is sort of a strategic communications framework. Like how can we think about any goal or problem we're trying to message to people? And so really want to just kind of give you that tool so that you have it. No matter what environment you find yourself in, no matter who you're talking to, et cetera. And then in the second half, I want to really transition to talking very specific about MLP, about some of the common audiences and messaging opportunities and challenges that come up, and what sort of some of that core MLP messaging is, particularly when we're talking to healthcare audiences and funders, although I know our audiences go much beyond that. As Bethany mentioned, I think those are the two that we most commonly get questions about. So if we go to the next slide, I really want to hear from you at the start here. And this isn't MLP specific, right? We're starting with this like broad idea of what makes for effective messaging and what makes for effective communication. And I really want you to think about the last time that you volunteered for something, like with an organization, at a child's school, something else, like the last time you volunteered, or the last time you donated, or the last time you really, got involved with something. And you can tell us what that was that you volunteered or donated for, or you don't have to. You can keep the actual thing you did separate. But what I really want to know is what inspired you to do it? What was that definitive thing that said, I'll donate here, not here, or I'll volunteer here and not here? So if you'd like to share, please raise your hand, and we'll have a couple people share out. And Lauren, it looks like you've got your hand up if you'd like to jump in and start.
Sure, thank you. I think this goes for volunteering and donating. Two things. The first thing is I was moved by the story and the cause. Mm-hmm. And the second thing, especially with donation, is that there was an outcomes-based approach and an impact-minded approach to the ask.
Yeah. Thanks, Lauren. So when I hear story, I hear there was emotion, like something emotionally resonated. And in the outcomes approach, there is a couple things, right? There's the belief that where my money goes matters, like it's going to have some kind of effect. And potentially even I know what that impact is going to be. So a lot of great things in that. Thanks, Lauren. Somebody else like to share? And if for any reason you have trouble unmuting or raising your hand, you're also welcome to throw things in the chat box. Yes, Erica, I see a hand up as well. If you would like to unmute and share.
I guess just in terms of what emotion, but, passionate about, something that you're passionate about, and also something that, and I know, this is about altruism, but in the end is how is this helping me or the people that I serve? Because that in the end, that's what people know. Like, I'm passionate about this, but how am I invested in this, and how is this going to help not specifically me, but what I believe in?
Mm-hmm. Yes. How does it serve my values?
Right.
Yeah. Thanks, Erica.
Well,
I think there might be one more. Oh, we have a message in the message box. Oh, just a thank you. Yeah. Do we have one more hand up, or is that still one of our, I'm scrolling. It doesn't move people to the top, so apologies. Okay, I came down. Well, thank you so much for sharing, Lauren and Erica. I'll also quickly share a story, which is that a place that I volunteer with is, it's the equivalent of Big Brothers Big Sisters, but instead of getting paired with a young person, you get paired with a senior citizen. And I've been doing this for several years now. And when I got involved was in my very early 30s. So I had been very close to my grandparents my whole life, all four of them. Wrote letters every month since I was 8 years old until the day they passed. Went to visit them regularly, vacationed with just my grandparents sometimes. And I lost one grandmother very young, but then I lost all three of my other grandparents in like a year, in like rapid succession. And it, like, the enormity of that loss and that like emptiness that it left in my life just took my breath away. And I remember I was walking around, I live in Boston, and I was walking around just the city streets, and I saw a bus stop ad for this organization. And it had a picture of a young person and a senior together. And the messaging was all about generational friendship. And it wasn't about, like some service you would be doing for an older person, right? It wasn't about like somebody being alone and needing things, or, putting somebody in some sort of sad or victimized place. It was really this like celebration of generational friendship and really companionship. And one of the messages of that ad and other ads from this organization is that like companionship is as vital as like food, that we need that in our lives for as well-being as much as we need any of our other basic needs. And what that sort of just awoke in me was that, as some others have said, as Erica was saying about values, like I saw a value I already held, right? How important generational friendship was to me, filling a gap in my life, something I believed about the world, something I needed, something I thought the world needed more of. And I remember I went back and filled out an application very quickly after that. And so a lot of the themes that you've already brought up, like feeling that emotion, connecting to something personally, sharing or advancing a value you already believe, is a real big part of how we act on information we hear. It's the difference between hearing something and nodding our head and saying, yeah, that's true, and then doing nothing about it, or hearing information, knowing it's true, like not in the head, but like deeper in our body and going, yeah, I'm going to do something about that. So if we go to our next slide, this is one of my favorite visuals. It's so simple, and it's from Simon Sinek. Are we able to go to the next slide? There we go. Thank you so much. And so Simon Sinek has a TED Talk. He also has a book with this concept. But what he was really interested in was this idea of like, how do great leaders inspire people to take action, right? There's all this noise and all this messaging and all these people trying to get other people to do things, but a handful of people do it really, really well. And he looked both at sort of social justice icons, right? But he also looked at corporations, right? Why can Apple Computer sell you a TV, but you wouldn't buy a TV from Dell, even though they have the technology and capability to make the exact same product, right? And it's all in that sort of messaging. And what he really found was the data he found, he codified into this incredibly simple chart, which is that communicators who aren't particularly effective start on the outside of this circle and move inward. So they tell you what they do and how they do it. And then maybe sometimes they tell you why they do it, but oftentimes not, right? And that really successful communicators start with the why and then move out to how and what. And so this really goes to a lot of those points that you raised in sharing your experiences, that people act because of what they believe about themselves and what their view of the world is, not because you tell them to do something. And so one of the examples he uses is that with the March on Washington, right? People didn't go for a specific speaker or for a specific leader. They went because of what showing up there helped them to realize about their view of the world and their place in the world, their like who they wanted to be in that conversation and in that space. And so anytime we're thinking about messaging, we really want to start from this place of why does this matter? And it goes again to an outcome, a desired outcome or a realized outcome, and not the process with which we get there, right? And so that's true of medical legal partnership. We don't start by saying, oh, well, a lawyer comes to the clinic and, you know, a doctor screens patients or a nurse practitioner screens patients. And then there's this handoff. And then if their legal needs are met, like if we start down that road, if somebody isn't in one of those worlds, they're already out, right? Like they've already tuned out. So it has to be about, you know, the thing we really care about is that everybody is housed. And here's one way we think is better about doing it, right? And especially when we think about the healthcare and legal worlds working together in times when you're having to message with each other, your what is so very different, right? What a doctor or a social worker or a nurse spends their day doing is so very different than a lawyer who's spending their day in housing court or immigration court. And how you address these social injustices are very different. But why you do it, especially on this webinar where we're talking to federally qualified health center folks, you are the parallel to legal aid, right? Like you serve the most overlap in population. And so this why of, you know, better, healthy, dignified lives for everyone, particularly people who are most historically marginalized, are the same. And so in speaking to each other, we really have to lead from the place of like, what is that goal at the end? What is that vision we have for health and justice? And then if people are nodding along and saying yes, then we get to how we're going to do it and what that process looks like. But if we start with what, people will check out and stop listening before you ever get to the important bits. But the why makes people sit up, lean in. And if they share a value, you find out quickly. But also if you share a value, they will stick around to listen to how and what. So I encourage you all to check out some of his other work. I put the name of the book there, but he also has a TED Talk and explains this in even more depth. So if we go to the next slide. So the reason I call this webinar Ditch the Pitch or Ditch the Elevator Pitch is because no matter who I'm talking to, whether it's MLP or non-MLP, people are always saying like, I need an elevator pitch, right? Like I need to be able to describe our work in 2 minutes so that when I'm, running into someone, I know what to say. And I'm kind of allergic to the idea of an elevator pitch because elevator pitches by their nature are trying to be one size fits all. Right? It's trying to say, what can I say to anybody I bump into, or what can I say to our funders? And your funders are all different, right? Like they have different priorities. Every single provider in a health center might have a different priority or things they're thinking about in their work, et cetera. So because people are different, organizations are different, situations are different, the idea that we're going to come up with like 1 2-minute spiel that's going to like solve our problems feels really disingenuous. And the goal, and this is what if you only take one thing away from today's session, like this is the thing I want you to remember, that our goal is always to connect the work you're doing or the thing you want, so your work or your goal, to something the person you're talking to already values, already understands, and already prioritizes. So this is about marrying your work or your goal or the thing you're trying to change to their mission. So saying the thing you want or the thing you do in the context of their mission. And that's true whether you're talking to a frontline service provider or you're talking to a housing foundation, right? If you're talking to a housing foundation, you're not going to pitch them on healthcare or legal solutions. You're going to pitch them on the most transformative way to get the most people safely housed. And let me tell you what that is, right? So our work serves that mission. And so this is what I want you to take away. Your goal has to connect to something the other person or the other organization already values, understands, and prioritizes. So if we go to our next slide, this is something that I encourage you to like print out, hang up above your desk or your workspace and keep handy because this is a way to think about anything that you want to message. So most organizations, and this is well beyond MLP, this is every place I've ever worked and every group I've ever talked to, the vast majority of people work right to left on this chart. They start with tactics. And so that usually, I will hear that in a variety of ways. Someone will come to me and say something like, I think we need a Facebook page. And I'll say, why do we need a Facebook page? And they'll say, because that's where the people are. And I'll say, what people? And then it starts this whole thing. Or someone will come and say, we really need a flyer. Well, why do we need a flyer or a one pager? Well, why do we need a one pager? Because, we go to a lot of places, where we drop in on policymakers or sometimes we're talking to folks at the health center and we just want like a leave behind. So you want one flyer for all of those folks? Well, yeah, just one thing I can just have. And that breaks all the things we were just talking about, right? That specificity. So when we start with this idea of tactic, we're already setting ourselves up for failure. And the way that we really need to think about strategic communications, both to save ourselves time and energy and resources, but also to be super effective, is to start on the left side of this graphic and work our way towards the right side. So we start by saying, what's our goal, right? So it might be we want to get money from this foundation. It might be we need to increase our referrals around a specific area. Like we're just not getting through. We haven't had any public benefit cases come in. We really need to, increase those referrals. It could be anything, but like a really fun, well-defined goal. So it has to be a SMART goal. It has to be specific, measurable, actionable, reasonable, and time oriented, right? So you have to know you have to be able to, it has to be something when you've achieved it. So sort of starting by setting that goal. And then you define the audience as small as you can, right? So it's who can make that goal happen. Sometimes that audience becomes an audience of one, right? So if you're thinking about a policy change, it may come down to like one state senator who's a holdout, in which case that state senator is your whole audience. If you're trying to increase referrals, it might be all the providers in a service area. If you're trying to get funding for from a specific foundation, that foundation is your audience, but it's the smallest group that you can define that can make that goal happen for you. And then message, we're going to talk a lot about specific message, but the way to think about message is again, thinking about what they value in this topic area. What do they care about? And what would make them sit up and say, oh, I see myself in that, or I see my clinic in that, or I see our mission in that. And that's what you need to tell them, because MLP, when we think about it, has so many benefits, but not all benefits resonate with all audiences. And we don't want to overload people. So it's asking ourselves, what does this person care about? And what part of this work will resonate for them? And then this might be, I think, of all of these, the most overlooked piece, which is messenger. And the messenger is, who will this specific audience believe this message from the most? And whoever the answer to that question in any scenario is the answer to who should be doing the messaging. So are they going to most believe a patient or client? Are they most going to believe someone like them? So if you're trying to get providers to do more referrals, is your best messenger a frequent flyer provider, like a frequent referrer who has had really good experiences? If you're trying to convince your, sometimes I see health systems or health centers that are trying to, work through a sticky situation with their MLP where they're struggling to do something like get on a third-party referral platform like Unite Us, or their general counsel is really iffy about the confidentiality concerns. And sometimes the best messengers in those situations are actually their peer institutions, right? Other hospitals or health centers that have done this already have not been, the walls have not come down, the building has not caught fire. And they can hear like, we did it and it was okay. And they might hear that message much better than coming from a frontline attorney or care provider. So there's a lot of different MLP messengers, but the answer is always, who will your audience hear this particular message from the best? And then the last thing we do after we're really, really clear on the first four things is we come up with our tactic. And that's just your approach. That is, oh, you know what? This is actually just a sit down meeting. We don't need to build anything. We're just going to go over and have coffee with these folks, and we're just going to have a conversation. And that is a tactic. So is social media. So is hosting an event. So is creating a flyer, right? So are all of those things. But oftentimes we burn a lot of energy building things or having meetings or creating tactics that are more than we need or just aren't what we need if we haven't done the first four steps first. And Reha put a resource in the chat box that I think can be helpful if you want to read a little bit more just about this process, which is Spitfire Strategies, which is it's a communications firm, but they are focused entirely on nonprofits. So they only do nonprofit work. And they have a guide to their smart chart, and it's a smart chart for strategic communications. And it's like, it has worksheets where you can kind of work through this if you have a big policy change thing or something else that you're really trying to think about. So if we go to our next slide, I want to start transitioning us to think about some of the things I've already shared, but we'll start moving us towards thinking about them in the MLP context. And I want to ask folks to raise your hand and share out a moment where you felt really successful talking about medical-legal partnership. Like, what was something where you're like, wow, I nailed that and we got a good result? And who were you talking to, and what was sort of your message or your strategy? Like, what do you think made that moment successful? So a moment you felt successful talking about MLP, who were you talking to? What were you trying to do? What was your message or strategy? I'll give folks a minute because I know you may have to marinate on this a little bit. And again, it doesn't have to be a huge thing. This doesn't have to be like, we changed the law in the state. This can be like, I was talking to a provider and they really, really got it. What was your strategy? What was your message? Yeah, Lauren.
So this conversation did not happen in my healthcare hospital house. This moment of a great feeling of success happened in the courtroom, because we used to go to court with some of our families and our MLP attorneys. And it was a conversation after the case was over about medical legal partnership in general before the judge, who was unfamiliar with the work, but we had showed up enough that our faces were familiar. We were with, hand in hand with our families, hand in hand with our attorneys and learners. So the experience of that for everyone, I think, was really powerful for our team, for myself. And I wasn't necessarily expecting it, because it wasn't in my house. It was in the house of law. And it was a very powerful moment.
Yeah. Oh, I love that. Thanks for sharing, Lauren. Yeah, Erica.
Yes, hi. So we have several medical legal partnerships currently, but it was easy when there's a recognition on the other side with our partner agencies, with the healthcare providers. When we're talking about obviously social determinants and integrated holistic care, they recognize that housing, income security, all those issues are so important. So already there's been a recognition that they can't do it themselves, that they need another partner. So I think it's been easy with those providers. More so in the behavioral health and addiction areas. When we are talking about primary care and hospitals, those have been the challenges. So I would love to hear more about that, the messaging there. But I think with our behavioral health providers, it's been easier because there's been a recognition that they can't do it themselves, because they're seeing all these needs.
Yeah. So that's great. Thanks, Erica. And I'm hearing like they already had a proximity. They have a different proximity to the problem. That perhaps different problems are coming across their purview every day. So they're primed in a different way. But also what I'm hearing you say is that which is really great, is that you're building on existing knowledge, right? That social determinants of health. You could go in and just talk about housing and justice, but even the fact that you're thinking about talking about integrated care and social determinants says that you're doing that, you're doing that homework to meet them in the language and the place where they start from. So that's really great. Thank you.
Thank you.
Bethany, I'm going to call you. I know you said you felt more successful when I see this in the chat, when you didn't start with MLP. Do you have an example you want to share of that?
Sure. Yeah, I learned pretty early on, even before I got to the National Center for Medical Legal Partnership, don't start with MLP, and also be cautious about even starting with lawyers. Look, as a lawyer myself, I know what people perceive of us, generally speaking, and that the general public may not understand what lawyers do. It's an antiquated field and very, protected. And so I think where I like to start is actually with just building upon what I may have assumed, but also confirmed during a conversation is something that frustrates someone. So for me personally, the things I get passionate about are the things that infuriate or anger me or frustrate me, if you go down the level of like emotion there. And I like to tap into that as perhaps fuel for others to act. And so in this space that we work in, I like to acknowledge that healthcare is doing the screenings, they are conducting the referrals, and they probably want to do so more effectively and efficiently. And where the healthcare field is right now is they just want the intervention. They want to know, what do I actually do with the things? And I know, Kate, you've been saying this for many, many years about MLP. It's healthcare wants to know, what do I do with the things that I'm finding are the problems that my patients are facing? So I tap into that. That's where I often start, and then offer what the legal services field does as a solution. And then the way to actually operationalize that solution is the evidence-based MLP approach. If I start with that MLP approach at the end there, but put it at the beginning, it's the conversation's over.
Mhm.
There's my story.
Thanks for sharing that, Bethany.
Sure.
And I really want to emphasize what you said about asking questions and solving problems. So a little bit later, I'm going to we're going to share a link to a case study from the People's Community Clinic FQHC partnership, which actually is the one that Keegan founded and ran for many years. And it's basically like it's like an oral history of the partnership and all the lessons that they learned. And so there's a lot of really great information in that. And I should caveat that I wrote it. And so I got to do the interviews with like the executive director of the health center and doctors and social workers and nurses and the legal team, and basically got to talk to like 15 people inside the health center who touch on this project in different ways. And one of the really powerful things that the legal team was saying is, we could come in here and say, here's what we want to work on. We want to work on housing, and here's how you spot it, and then refer to us. But Keegan and her team took a slightly different approach, which was to what Bethany is saying, which is to talk to the providers and say, do you have patients who have like some of these social needs? Like what's the patient who has the problem you can't solve? And then they went out and they solved it for that provider. And then they never really needed to do any training or nudging with that particular provider ever again. After that, the MLP and the legal team was gold in their book, right? It was sort of like, oh, this person solved that patient who keeps coming back, who I can never find any help for, who slows down my clinic day, right? Because I'm supposed to be in there for 15 minutes and I always spend half an hour with this patient and there's nothing I can do. And I've been seeing this person for 5 years. And they find those thorns in the provider side. I'm not referring to people as thorns, but I mean like those situations that like are unsolvable from a clinical perspective. And instead of coming in here and saying, here's one more thing you got to do, screen for legal needs, and I want to do housing, so find me the housing cases. It's coming in and saying, what's your biggest problem? And let me solve it for you. And then after that, people sit up and listen. And so, Erica, I'm going to connect this back to what you were asking about, because if the mental health professionals and some of the other groups already get it, because the needs that they are seeing and the problems that they're trying to solve are already the ones you're talking about. And so with other groups, I really think about having those dialogues and asking the questions, what are the issues you can't solve? And then figuring out if you can solve one or two of those for them. And then all of a sudden it changes the entire dynamic. So be a service instead of selling a new thing. And sometimes that little reframe and that dialogue over monologue can be really, really helpful. So thank you, three, for sharing. Let's go to the next slide. And I want to use the chat box for this and have everybody reply. So I'm going to read out 3 statements, like they're going to be half statements, and I want you to fill in the blank with the rest of it. So I'm going to read the first half of the statement, and I want you to finish it in the chat with the word or phrase that first comes to mind. So don't overthink it. Just put the first word or phrase that comes into mind for each of these. When it comes to talking about medical legal partnership, I am really good at. When it comes to talking about medical legal partnership, I am really good at, fill in the blank. Give folks another minute to type in, but I will read these out loud into our shared space here. All right, when it comes to talking about MLP, I am really good at talking about the patients, sharing enthusiasm for MLP, expressing the needs, advocating for interdisciplinary care, talking about the benefits of legal aid, being passionate about the need, discussing what legal aid can do, sharing stories and examples, providing real-world examples, asking questions, awesome. Thank you all for sharing. All right, the next one. When it comes to talking about medical legal partnership, I struggle with. When it comes to talking about medical legal partnership, I struggle with. Give you another minute and then I'll read these out loud as well. Okay, when I talk about medical legal partnership, I struggle with condensing my statement, getting buy-in, finding enough resources to support the entire team, connecting how guardianship for an incapacitated adult is connected to the social determinants of health, agree with condensing, not speaking in legalese, getting buy-in, others lacking capacity. Another +1 for struggle to condense what you want to say. How to be helpful when there is no legal solution. Not having it turn into a technical assistance session if that's not the point of the conversation. Awesome. Thank you, everyone. All right, last one. The audience I most struggle to talk to about MLP is the audience I most struggle to talk to about MLP is. Okay, the audience I most struggle to talk about MLP with is attorneys and trying to get them to volunteer for the program, other attorneys at my legal aid firm, funders, CEOs of FQHCs, healthcare admins, providers with unrealistic expectations, attorneys, so I see a full range of audiences here in the chat box. Okay, great. Thank you everyone so much for sharing and weighing in. If we go to the next slide, I want to talk here a little bit about some of the core healthcare MLP messages. I know we have a wide range of audiences for MLP, but these are messages that focus on the healthcare side, but on the funding side, right? So these are messages that we can think about in terms of healthcare, like CEOs and C-suite folks. We can think about this in terms of like foundations and healthcare funders. And we can also think about this in terms of like frontline providers. Now, as we showed in that sort of diagram of the strategic communications process, just because the message might be similar does not mean our approach would be the same, right? So if we're talking to a foundation, we might be submitting a grant report or a grant application, right? Which is like really formal. And if we're talking to other providers or providers and, you know, frontline providers, we might be just like grabbing someone in the hall and having a conversation. So it doesn't mean that the messaging is necessarily formal or informal. It can be either. But these are sort of those different values we might tap into. And so I'm going to share 6 And not all 6 will be right, even within this healthcare realm, right? It's about understanding, again, why that CEO or that health system or that foundation or that frontline provider, like, what is that real need that they have, or what is that problem they're trying to solve, and how does MLP sort of fit into that? And just a couple of broad notes before I dig into these 6 messages. Is that these are just 2 really good overall strategies. So it's always good to think about pairing one compelling statistic with one story that illustrates it. So I saw in the chat box a lot of people, saying how they struggle to be brief. And I think that is a common problem well beyond MLP. Because it happens because when you know so much about something and you're so passionate about something, you feel like you got to say it all, right? Like, I got to tell them everything this thing can do. I got to tell them every benefit it's ever had. And I have to describe it in a lot of detail. And we're actually a lot more successful when we just sort of lead with one like benefit or one really cool idea and statistic, and then a story that illustrates it, and then kind of back away and let the dialogue go where the dialogue goes from there. So instead of trying to get it all in, think about what's like the most compelling stat within each of these messages, and what's the best either patient client story, workforce story, so how you were changed as a lawyer or how you were changed as a healthcare provider by having this partnership or these access to services. And I think that is often, how much you say or where you go with it. And always focus on outcomes, not processes. So, how health has changed, how workforce has changed, how policies are changed, not the like step by step of how that happened. Like, I say this with all the love to the attorneys in the room, but no one needs to know the process of what happened in housing court, or the details of the legal case unless you're in a legal proceeding, right? And so really thinking about how to focus on those outcomes. So I'm going to walk through these, and I know Reha is sharing things in the chat. But the first message is that legal services or medical legal partnership improves patient health or well-being. So for those healthcare audiences that are really dialed into like, our mission is to make health and well-being better, for those providers who are like, listen, I just care about the well-being of my patients, then we have to talk about how MLP and legal services improve health and well-being for patients. If you have data from your site, if you have a site, if you're operating a medical legal partnership and you have data from your program that shows this, your data is always the best data, like your local data, even if it's small, whatever data you have from your health center partnership, that's what you lead with. If you don't have your own data, then the next best data is either data from your state or data from a similar institution, right? So if you're in a hospital, you want to show hospital data where you can. If you're in a health center, you want to show health center data where you can, because institutions care about their peers, right? You also don't want them to be able to write it off, right? You don't want to have a health center say, well, that's easy for a large hospital to do, right? But not for an FQHC. Or you don't want someone in, South Carolina to say, well, that's California. There's funding for things in California that there isn't here. So the closer you can marry it to your institution and population, the better. But if you have neither of those things, then you go for national data, right? And then you pair it with local stories. And so these are the stories and stats about how, when we talk about well-being, these don't necessarily have a connection directly to health, but this is about how MLPs do things like help people maintain safe, affordable, and stable housing, or keep their utilities turned on, or do any of those things that fall along those social determinants of health, right? And so Reha is linking to studies from different places across the country that have shown exactly those benefits. If we look at specifically health, then we talk about how MLPs improve health in populations wherever we can show it. We have data that improves health in asthma patients, glycemic control in people with diabetes, reduced stress, and improved mental health. Again, if you've got data locally or you're working with a different population, that's great. But all of these things are good conversation starters. And then the last link that Reha shared is one to the National Center's YouTube page. So when it comes to telling patient stories, these are short 2-minute clips of providers from different MLPs around the country sharing their patient stories. And again, you would want to use a local story, but just to give you some inspiration for folks telling those stories. If we move to the second message here, this is the one I've heard most said today, which is that legal services and MLP provide a tangible intervention to what is unearthed by social needs screening. So if you are talking particularly to hospital administration, this is about you've invested all this money and time and effort to screen for SDOH. You've developed specific screeners. In some cases, you have hired specific staff to do nothing but this screening. And then when you find this information, most of the time, you're just sending people out to the community, crossing your fingers and like hoping it works. And that can be really deflating for providers who are just, winging a prayer, sending people back out in the community. It can also just be like, it's like not finishing like the start of this. So if you have gone as far as to think that SDOH is so important that you screen for it, then you should want to treat it too. And we are one of few interventions that are treating it right here in the health center. So that's number 2. Number 3 is the last one that has to do with patients and clients specifically. So number 3 is around legal services and medical legal partnership can increase patient engagement in their healthcare, right? So this is something that a lot of health center CEOs care about, a lot of healthcare admins care about. This is about, you've got providers who are prescribing medical treatment, and maybe patients aren't adhering to that, right? And so there's been this idea for years in healthcare of like non-compliance, like patients just aren't complying. But the truth of the matter is like that is a very patient blame mentality, right? When the reality is that a lot of people don't quote unquote comply with their treatment because they're literally not able to. They don't have the transportation or the money or the resources in other ways to get the food or the medicine or to the places they need to get to comply with that treatment, or maybe they're just way too stressed because they're facing an eviction and they can't like focus on these other things while they are. So the ways that we can talk about, when people receive legal services, your patients are actually going to better adhere to their medical treatment. And there are some links to studies that talk about just that. And they're also going to utilize emergency department services less and engage with like a primary care medical home. And there are studies in the chat about that as well. And the last resource that Ray has shared is one of my favorites. It's sort of it's an older piece, but it comes from NACS magazine. And it's an interview with 4 health center CEOs about why they invested in medical legal partnership. So it's really in that health center CEO voice and talking about the things they cared about. And one of the things I like in that piece is the CEO of executive director of Whitman Walker Health in Washington, D.C., talks about how a lot of their patients actually come to them through the legal clinic. So they have one of the most robust medical legal partnerships in the country. I think they have 12 to 14 lawyers. It might be that large. I hope I'm not misrepresenting that. But they focus primarily on LGBTQ populations, and they do things like their clinic does a lot of like a legal clinic does a lot of like name changes, right? And gender marker changes on IDs. And so a lot of people come to Whitman Walker first for the legal clinic and then re-enter care after being out of care for a really long time. And so when their CEO talks about the benefit of medical legal partnership, he always says that for us, it's really about like, it's this place where, people come to actually trust us through our medical legal partnership. They come into health services, right? Which is the mission of the health center. So if we go on to our next slide, these 3 are all messages about messages for healthcare that aren't specific to patients, but are about the larger system, right? So number 4 is talking about legal services or MLPs that improve the workforce. So the healthcare or health center workforce knowledge and satisfaction. So these are stats about the fact that MLPs, when there are, lawyers on site, providers are not only more likely to screen for social determinants, but they're more likely to see that screening as part of their job. And medical legal partnerships have also increased job satisfaction among providers and helped them to work at the top of their license. So basically, like, because there's a lawyer dealing with X, Y, and Z, I can go back to just doing my job as a provider, and that increases satisfaction. So talking about these things with different folks might be the message that resonates. And I know I'm throwing a lot at you. These are options based on the audience that you know and the thing they value. It's not a throw everything at them. It's the pick the one that's going to resonate the most. Number 5 is really about financial stuff. So number 5 is that legal services and medical legal partnerships can sometimes save healthcare institutions money. In a lot of cases, more money than the program costs, right? Save more money than it costs to employ a couple of lawyers. So this is stats and stories about reduced hospitalizations, and there are 2 really great studies on that, both in pediatrics and in adult populations. And then there are several MLPs that have done studies around the amount of money that they have recovered for healthcare organizations by getting patients who previously weren't on insurance, on health insurance, like Medicaid, Medicare. And then once they were able to appeal those denies or get patients on those things, healthcare institutions were able to go back and then bill for previously unreimbursed clinical services and recoup, in a lot of cases, millions of dollars. And what those studies have found is if you even have like one of those cases that recoups a lot, it can pay for your medical legal partnership 10 times over. And there's a study in Carbondale, Illinois, that really showed that. They had like 10 patients who they recovered a lot of money, and it was like enough to run their medical legal partnership for over a decade, if you look at it in those terms. And then the last one is really about these bigger global issues of equity, right? That if for medical legal partnerships who do engage in policy work, that these partnerships can have a really broad impact on greater equity, if that is part of the mission. I think about this particularly with foundations that you might be applying for funding, or some admins as well within health centers and health systems. But this is stats and stories about patients to policy work. And there are 2 linked here. One about a health center in Chicago that was able to improve housing by raising national lead standards. And the other one is out of Whitman Walker, and it's about preserving access to certain healthcare plans on the insurance exchange, so that people didn't get boxed out of really what would have become really, really expensive care for certain chronic conditions. So all of those links are in the chat box. But if we go to our next slide, this is just summarizing the resources here. And if you're clicking furiously on these and you're worried you're not going to be able to bookmark all of them, or you want to take a deeper look, there's a couple of these resources in the chat and in these QR codes that summarize these resources, so you don't have to try to track them all here. So the resource here that says going beyond ROI to capture MLP value really outlines all of these different arguments for health systems and links to a lot of these resources. So that is one place where you're going to like catch all of these in one place. Same with the NCMLP website impact page. So they break it down by patients, workforce, and policy, and link to a lot of studies and information that you can use if you don't have the data locally, or use it to inspire data that you're going to collect locally. And then just a couple of others here quickly. That NAC magazine article I mentioned is there, the one with the FQHC executive directors. The Texas MLP case study, the oral history, is there that I mentioned, where you get to hear from a lot of different healthcare team members in one place. The Patients to Policy MLP story series is linked there. And then there's also a messaging guide that I put together for the National Center probably over 10 years ago now. The stories, I would redo the stories entirely. They're really more case examples than they are stories in that guide, but the messaging really still holds, and can walk folks through a lot of this. I have one more slide, and then I'm going to pause and we can go to questions and anything that's burning on your mind. This is really relevant considering I saw some questions in the chat about like managing provider expectations, or really helping people to understand, once you're already in partnership and you're not just like selling the idea of MLP anymore, but you're actually really doing the work on a day-to-day basis. A lot of providers have questions about like what happens after I refer someone for legal services. And then there can be confusion because it's like, oh, you just talked to the patient, but like you didn't actually go to like court with them or represent them in court. So did they actually get anything? And this is a resource. We can put this in the chat box as well. This is the patient legal journey. This is part of the patient legal journey job aid and training, which is really about like helping healthcare and healthcare providers, and specifically to understand that like legal care is like healthcare in that we're trying to find the right dosage, right? So sometimes we do just give brief advice and information, and that's all the person needs to actually like prevent the eviction or solve an issue or prevent an issue from escalating, right? And that really like this is the equivalent of you know, sometimes people need heart surgery, but what we really hope is that we can get them on blood pressure medication before they, you know, have a heart attack and get to that situation. And even better, like we're hoping that we can do diet and exercises changes so they never need the medication in the first place. And so when patients are referred, like their legal issue may fall anywhere on that spectrum of like needing prevention, needing blood pressure medication, or needing surgery. And going to court is like the surgery of the legal world. And so you like, it may seem like the client is getting the most intervention or the most bang for the buck, but it's actually often a situation where the client's in the most stress, right? Has the most dire need, the consequences are the highest, and we actually want to catch as many people before that as we can. So getting information and advice is actually a great thing, and can be just as valuable. And this, you know, using those kinds of analogies is the exact kind of thing about sort of tapping into people's existing knowledge, you know, making that metaphor for them within the healthcare world. And, you know, I'm part of the technical assistance team working on the Kaiser Permanente Medical Legal Partnership launch in 5 sites. And a 2-year study showed that like 85% of all the cases or of all the touch points that the lawyers had with patient clients were these brief information and advice. So a lot of that education when the KP executives and everybody started seeing that data was like, why do you need a lawyer for that? Like, isn't a lawyer just to go for court? Like, why is a lawyer giving advice? So much of that education has to then be done of, no, a lawyer still needs to be the person to give that advice. It's actually still a great intervention. And here's why you want it, and here's why you need it. So I really encourage people to download this resource because I think it has some of the most recent and advanced messaging around this. And you're welcome to adopt and use this training if it's helpful in your partnerships. Okay, and then last, these are just some quick reminders about anytime you're messaging anything or in MLP. So when we're communicating, things that help catch people's attention. So lean in, listen, really care about something. Those are stories because they elicit emotions. Sharing bold facts. So things that like stop our brain and go, what, did I hear that right? Right. Sort of, I don't mean shock value in the gross way, but I just mean shocking as like, I never would have imagined that. Or as we've talked about, to ask a question. And so to start that dialogue. So as Bethany was saying, I don't go in and tell them what I want them to, I don't tell them what I want them to look for. I ask them what they need me to solve. So asking those questions. And to increase understanding, we connect to cultural cues. We use familiar language and familiar analogies, like we just did with the surgery to the legal world. I see a question in the chat, Reha, that someone got logged off, and I don't think we can repost all of the resources from all the slides, but can we do can you repost in the chat the last 6? Those have the summaries, and all of the studies that were shared earlier are captured within those 6 final links. Okay, and then for you, be prepared to know before you talk to anyone the following 4 things. So the first one is, what's your story? So this is, why do you care about it? So you know, whenever we speak from a place of personal passion, we still want to be connecting to their value, but people want to see that like we care about it and we're excited about it. So what's your story? Not your patient's story or whatever, but like, why is this meaningful in the context of your life and what you're doing? And you should be able to answer that or share that with folks. The second is, why is this urgent, right? This is a big thing about getting people to ask now. When you think about, if we go to the next bullet, if you think about with foundations, especially who are inundated with proposals, they may think everything is important, but they can only fund a couple things. So why is this urgent? I teach at Northeastern, and I always tell my students, good strategic communications isn't about teaching or convincing people that something is good. It's about convincing people that they have to act today, that there's no choice but to take action today. And that oftentimes what's happening, and I want to caveat this by saying I hate this, the competition that exists in the nonprofit world and the way that we always feel like we're stealing resources from something else. But there is a sense that, like, especially with foundations, you're lining up 10 things and they think all 10 are good, but they can only fund 3. So why is this urgent? Is really important. And then the next bullet is, what's that question you would ask someone, that particular audience, that will help them to connect with what you're sharing? So think of your 3 most common audiences and think about what question you could ask them to invite them into the thing you're then going to share. And then the very last one is, the very last bullet is, what makes MLP or your approach different? So in communications, I've often heard this said as, what makes you a constituency of one? So every organization on the planet, every intervention on the planet should be able to answer, every for-profit company should be able to answer why we're different. Whether that's we reach a different population. We are the only organization that does this work in the area that speaks Spanish, like that has Spanish speaking practitioners. We're the only one that is client or community led. We are the only one who does X, Y, or Z. We're the only one who serves this population or this area. Something about why you're different or why your approach is sort of singular. Because if you can't answer that, you probably shouldn't be in business. If someone else can do it or can do it better, you probably shouldn't be here. So if we think about marrying these things together, why is this approach different? What makes it urgent? What's the emotional connection to it? And what's the question you can ask to invite someone in to start thinking through their own life and their own experiences that will help them start to place the information that you're going to share. And with that, that is all of my prepared slides. And I'm going to open this up to Q&A. And it can be Q&A about anything we've talked about, or a different audience that's a burning mind or a front of mind. Or if you have something that you want to share out, a best practice, a resource, really encourage you all to raise your hand and unmute. But also you can use the chat box if you prefer.
Okay, I'll just hop in to just remind folks that if you happen to have that technical issue, we did reshare some of the resource links in the chat, but Reha has also noted that tomorrow on the PIP webinar series webpage on our website, the links that are embedded in all the slides, as well as the recording, will be on that webpage. So we'll make everything available shortly.
Awesome. I also saw Bethany jumping into the chat to connect some of the different messaging things to the quintuple aim for healthcare and HRSA's Health Center Excellence Framework. So thanks for making those connections and sharing those links as well.
Sure thing. If it's okay, I actually want to call on Dr. Lauren Mutry out in Oregon, because Lauren has been in the medical legal partnership movement, as she'll probably share, since she was a baby lawyer, her words. And she helps to, I think, convey the message that we like to tell about MLP's ability to allow practitioners to practice at the top of their licenses, and the value to her as a clinician now that she's been in the movement for so long. Lauren, can I pick on you if you don't mind to share a little bit about? Thanks. Thank you.
Well, I was really fortunate, and my first year of medical school back in, uh, gosh, 2003, I was exposed to medical legal partnership as a part of my bread and butter education at 22 years old at Emory. And I never knew anything different about how you could practice medicine alongside an attorney. And I tell people this all the time. I was very fortunate, and I had that my entire time in Atlanta and as a young doctor in training and pediatric residency. I always had MLP in my back pocket. And when I moved to other places to practice, actually throughout the world and throughout the United States, I could not do my job well. I could not serve my patients fully and holistically without an attorney. So when we didn't have medical legal partnership in whatever children's hospital I was at, we built one and adapted it to the needs of our population and region, with clinical care, and then also ultimately with policy reform over years. And so, that's just a little bit about my story and how I see this work. And just really, I cannot practice medicine without medical legal partnership.
Do you think?
Thanks.
Thank you, Lauren.
Thanks for sharing that, Lauren. And I think everything that Lauren just shared really underscores, again, that idea of messenger. Because when I listen to that, I mean, that's so powerful to me as not I'm not a doctor, a lawyer, a social worker. I'm not any of the things. I'm the rare thing in the medical legal partnership world, which is, and then I have none of those letters. But it's incredibly moving. But I know that when other providers hear that message from a fellow provider, that is different. Again, that sounds so different from a lawyer saying it. Because, and I'm not saying this is what any of you are doing, but there is just something inherently that when lawyers are telling healthcare professionals that they need to do X, Y, or Z, it is almost sounds like you're adding something to my plate, right? I can have that feeling of like, I have 15 minutes with a patient. Like, what else do you want from me, right? Like, what else do you want from my time? Whereas if a provider is saying like, oh no, like I can't do my job without this. And let me tell you why, like this helps me do the core of my job better. It is just such a different posture. And even if the information is just as good, and even if it's the exact same message, it can feel so different. And, Lorna, I've heard other docs say the same thing. I remember Carrie Rodabaugh, who's an oncologist, when she moved from New York to Nebraska, made it part of the contract she signed with the hospital that she wouldn't even move there and take the job if they didn't also launch a medical legal partnership at the same time. And those are some of my favorite MLP stories. I love hearing yours.
Could not agree more. That is a great.
Yeah. Erica, I see you have a hand up.
Yeah. So what Lauren was saying, that of course resonated with me because it's exactly what you were saying, Dr. Rodabaugh, in that 8-minute video that I really, again, I take it with me and I show it wherever I can, because it comes from the medical community. And attorneys, we're preaching, kind of the same thing. And the providers that we're presenting to are thinking, or could be thinking, well, it's self-serving. We want to hear from medical practitioners who actually do this. So I think it's so important, not only for the legal community to come out, but the medical community to come out and really push this forward with their colleagues. I'm presenting on medical legal partnership in 2 weeks, and my biggest, I keep on mentioning that it's not the lawyers who we need at the table, because the lawyers know all about this. It's the medical community that needs to be at the table. And if we can get, Lauren and other medical practitioners to present and to present a webinar that we can take with us. And, like I said, I've been doing that with the 8-minute video from Nebraska. But if we can have something a little bit more recent, that would be very, very helpful. because doctors listen to their colleagues, listen to other doctors, and they want to know what the benefits are, not from us, but from their own.
Yeah, absolutely. Yep. And I think, and having and record, I mean, we've done some recording of those things. I think recording more of it would be really, really helpful. And I also always encourage folks to like find your local Lauren, cultivate your local Lauren, inspire the passion in one doc and take them everywhere with you. It's yes, and it's all of it. We need it recorded. We need it national. We need it at big conferences. We need it on all the stages. And we also need it in every local partnership and community. Dalma, am I saying your name correctly?
Yes.
Okay, I think you're up next.
Hi, everybody. Dalma here from Legal Aid of Marin, which we are legal aid in the Bay Area, about 30 minutes north of San Francisco. And we are the only legal civil services in our county, Marin County. And we are in the really early stages of researching MLPs. But I'm wondering if anybody knows of cohort or some system where doctors and lawyers and really anybody involved in the MLPs can connect on a one-to-one basis. Really early, we're already starting to see some concerns being raised by lawyers. How are we going to work in a medical setting in A, B, and C? And we expect that will be the same reaction from the medical community here. So I think that one-to-one relationship building with other people that have gone through this process is so important. So I'm just wondering if anybody knows of people that would be willing to do that, or maybe a cohort that's already doing that.
Yeah, I think what I would recommend here is to offline after the webinar with Bethany. And I know that part of what the National Center does is to help connect people to other people in the field to have those conversations and do those kinds of things. Bethany, am I speaking out of turn, or am I, is that accurate?
I'm sorry, I was nodding in the wrong direction. Yes, we're happy to help. I just put, and we're doing that constantly, right? So send us an email to ncmlp@gwu.edu. That way the NCMLP team can ensure that request to connect with each other doesn't get lost in my personal inbox. And so, Lauren Mutry is here and online from Oregon. Also, we know, and Mary Jo Dudley is going to speak up in just a moment, that there's a request for help, right, on MLP for farm workers. Erica Kerber, who's been speaking, is really leading in the space of developing MLPs with CCBHC. So I want to put in a plug to reach out to these folks right now in the chat, but also send us an email so that you know why I'm calling some of these folks out right away on this live event. It's so that you can reach out to them for a specific type of guidance or networking for the type of message or support that you need. So yes, email us, happy to help.
Thank you so much. That's great info. Thank you.
You're welcome.
Thanks, Bethany. I think we have time for just one more question or comment here before Bethany takes over the wrap up. So Mary Jo, if you'd like to unmute and ask your question or share your thoughts, that'd be great.
Yeah, thanks so much for giving me a couple minutes. I think the MLPs are being very much promoted at the national level. I'm on the National Advisory Committee for Migrant Health, and we've talked a lot about these, but we see hesitancy at the local level. And so for that reason, over the next 2.5 months, we're doing a systematic research, interviewing people how does it work? How can it be successful? Because we want that to be entered into the discussion about opening these for in rural areas for in particular for farm workers and other immigrants. So I would really appreciate, I put my email in the chat. It's farmworkers@cornell.edu. And we have 2 graduate students who are going to be working on this all summer. So if you're willing to speak with us, we'd really appreciate it.
Mary Jo, before you go back on mute, can you just briefly explain to folks how I could use your help helping explain to folks how significant this request is because you talked about the National Advisory Council, and I don't know if everyone's aware of what that is, and that it ties to HRSA as a federal agency and priority around the country.
Yes, thank you for giving me that time.
Mm-hmm.
So the National Advisory Committee on Migrant Health prepares recommendations for Secretary Becerra from HHC and HRSA, to which he responds. And the medical legal partnership as an avenue for improving farm worker health is something that we've discussed at length. But what we're promoting is, if this is an approach that we can prove through the experience of others and research, would be a good investment of federal funds specifically to address the needs of farm workers, we need to have some research. We need to have some proof. We've seen the websites, we've seen, the random statistics. But one of the questions that was raised in our meeting, and it's a group of 14 people who were appointed by Secretary Becerra to serve on this council, is this kind of question around the country. Well, we need to see where it's working well and understand the logistics before we're really promoting this as a pathway. And so we're trying to take that deeper dive. And then that feeds into a recommendation to which Secretary Becerra has to respond. Does that help, Bethany?
Very much so. And I was trying to quickly find, and managed to do so, paste the link, a hyperlink to the advisory committee's webpage. So in the chat, folks will see where they can find more information about the National Advisory Committee on Migrant Health. Mary Jo, I'm really glad you attended today. And as folks should, you may see on that webpage, if it's posted yet or not, I'm not sure, that the National Center for Medical Legal Partnership did recently present on the role of medical legal partnerships and what it can do to improve migrant health. This is a priority for the National Centers to reach those particularly hard to reach populations. And whereas we already partner with HRSA through the NTAP program, the National Training and Technical Assistance Program, to advance MLP in the health center program, this fits squarely within our overall approach to expand that model for this particular population. So please, Mary Jo's email address, is it the farmworkers@cornell.edu, Mary Jo?
Yeah, that's my email address.
Perfect.
And currently I'm the chair of that council, so we're really trying to push things forward as soon as possible.
Thanks so much, Mary Jo. That was perfect, and I'll help amplify that as well on the NCMLP website and in our newsletter. Greatly appreciate that. Please, folks, I encourage you to reach out. Okay.
All right. Well, with that, I think as much as I'd love to keep this conversation going all day, we're close to time. So I am going to hand it back over to Bethany to close us out. But I just want to reiterate that I think, there's a lot of resources flying. There was a lot of information thrown at you within the context of this today. But again, if you really only take one or two things away from this today, that it's really about marrying what you do to someone else's mission, like putting what you want or what you do in the context of what someone already cares about. And that messenger matters almost as much, if not more than message, that cultivating the right people to talk about this and thinking about who those people are and getting them on board with helping you in this work is probably more vital than the message itself. So those are the two things that I really hope that you will walk away with this. And with that, I'll hand it to Bethany to do wrap up.
Thanks so much, Kate. And I also want to thank, before we close out here, everyone for being really engaging and interactive on this entire webinar series. As we went into this series, we really, again, thought about how to provide this technical assistance and training based on our Health Center MLP toolkit that you see on the screen. It's our seminal resource for helping the field to grow, advance, and improve their practices. And so I really want to thank you all for doing what is not always easy, which is, speak up, talk, ask questions. So in addition to thanking you, Kate, for joining us again today to talk about messaging I also want to thank the audience for engaging as learners and also teaching us along the way about how to better meet your needs as the medical legal partnership field. If you have a really super technical question, we've been encouraged to share the Bureau of Primary Healthcare's contact form, where you can pose those really highly technical and specific questions about the health center program and how to integrate MLP in that more technical way as it pertains to the grant, for example. But then if you want to continue joining us for the closeout of this series, right, if you want to go to the next slide. Reha's actually working multiple screens behind the scenes, so bear with us. So on this slide, you'll see that next week, right after we come back from Juneteenth, we're going to be meeting with another set of MLP practitioners from Philadelphia. They're partnering with multiple healthcare providers throughout the city of brotherly love. So the Philadelphia Legal Assistance team is going to join us to really talk about their partnerships with 2 health centers in Philadelphia to help move OUD and SUD care upstream by partnering with their organization as legal aid. So sign up for it. If you happen to be taking the day off following Juneteenth, just sign up so you can at least receive the recording and also be able to pose any questions that you'd like for the presenters to ask. But hopefully we'll see you there live again for similar engagement. So on the next slide, just want to close out quickly to let folks know that the way we will be wrapping this entire series up and tying it with a bow is by opening up a full MLP town hall interactive forum where we'll just talk. It's going to be a guided conversation, of course, to keep things moving along. But we'll talk about best practices, tools, what are the challenges that folks are facing as it pertains to MLP planning, implementation, and practice. So when you go to the link on the website that Reha just shared, go ahead and sign up for that closeout town hall event as well. Feel free to also share it with your colleagues because it's going to be an event that we want to make sure is open for the broader medical legal partnership field. Also, and finally, in the chat, Reha is going to share 2 more things. A link to our brand new, as we promised, publication. This is an issue brief that was developed as a result of our learning collaborative that we hosted last summer on performance measurements for sustainability. So that issue brief is finally out. It is not overly academic. In fact, it's built more as a toolkit that goes step by step through performance measures that really drive and foster sustainability. So download it. And then finally, as we close out today's event, I must ask you, please fill out our evaluation survey. Let us know how today's webinar went in terms of effectiveness and value that it will bring to you. And then one more time, let me just thank you all for continuing to engage in this webinar series and thank Kate Marple as well. Let us know if you have any questions by reaching out at ncmlp@gwu.edu. And then also can't neglect to thank you to our partners at Texas A&M University at the Institute for Healthcare Access. Thank you again, everyone, for closing out. Have a great day.